As technology advances, innovations around science and health are proving to provide solutions to long-standing challenges like the disproportionate number of health workers to patients. The ingenuity of the team at Makerere Hospital explains the desire for alternative ways of practicing medicine. Professor Josephat Byamgisha is the director, Makerere University Health Services.
Find somebody has had like an abnormal discharge for like 2 years. And it's not going, it is coming, it goes.
Recurrent.
So it's recurrent. So what is done here is, extensive checking the history, how has it been, doing an examination, and critically, like was emphasized in the video, laboratory diagnosis. Because at times treatment is given without checking what it is, or at times not even examining, because as we call them private, some people don't actually want them to be seen, but that disease may not go until somebody really physically checks, so that they treat the right thing or get the right sample, which is taken to the laboratory, and the diagnosis can be confirmed. This could be immediate, but at times it can take 48 hours, like if they are to do the type of disease and what medicine may work on it. That could be more than 48 hours.
Professor Byamgisha, working with his colleagues, have made the application available for Android phones for now.
It has a search mode whereby you can put a symptom and you search. So when you have a certain symptom, you just put it there, then it will give you the possible reproductive tract infections that can give you such infections. Then you can read more about them so that you can try to understand. Then next, it has the emergency icon. When you press on that one, it will just directly take you to the number of the ambulance driver who is actually on duty. So that when you click and you call the right person. That is in case you have an emergency. However, we encourage you people, when you are at your home in Mukono, don't call our ambulance driver. You do this when you are at campus or in Chikoni around there, where you can be accessed within 30 minutes. You have the chat with the doctor button. When you press it, it will take you to a WhatsApp number of the doctors. Sometimes I'm the one, sometimes another doctor. Then we can have a chat. Yes, we can have a chat. You can make your inquiries. Sometimes some inquiries don't need you to come to the hospital, so we shall not ask you to come. I will just tell you it's okay. Don't worry.
The underlying issue, however, is the trend of treatable reproductive tract infections. The experts say it's common for women, especially, to suffer such infections, whereas some do not seek appropriate care. Men equally get affected. Some of the infections, like vaginosis, are not necessarily transmitted sexually, but stigma around the infections can keep the patients away. Many of them, though, are asymptomatic.
Reproductive tract infections are quite expensive in terms of costs. And maybe if STIs were linked to the reproductive system, possibly people would be more cautious. Because now we just look at the STIs, but it is much bigger. The problem can be more prolonged when it enters the reproductive system in terms of costs of disease treatment. So the best, like has been indicated, is when it is treated very early. For example, if you look at a case of infertility, if those fallopian tubes are blocked, handling that in terms of treatment is very expensive and at times not even affordable. So somebody can be denied the effects of even having a child because of this infection that was sustained at an earlier age. And so that's why we feel the information should move more to the public and we go beyond STIs.
In this digital era, Makerere University is leading in the use of data. And it is only data that is going to tell us more information. So I want to encourage my fellow citizens who are shying away from this data, saying that if we link it to our national ID, it is not going to be safe. This data is protected, and we can only develop as a country if we integrate this data and use it for our health, the health of our community, but also for their development. Some of these infections are extinct in some countries because they have utilized this data and been able to prevent them and even treat them immediately.
We want people to initiate care at individual level so that we don't delay anything. So with this innovation, someone cannot delay care. You are able to log in. It's because your phone is next to you. Log on, put in your complaint, I have this, and you are able to get an interaction with a clinical care provider. It's very appropriate for young people. So for us in reproductive and adolescent health, this is very transformational. Of course, Ministry of Health, we have a call center where young people have been calling in. And most of the issues they ask about are sexual and reproductive health. So this provides another very good platform.
The application was funded by government through the Makerere University Research and Innovations Fund.